Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome back. This is Dr. Jacobs. In this video, I'm gonna go over 8 surprising causes for sciatica nerve pain. It's very important to understand and know what the cause is, because that will determine what kind of treatment you will receive for effectively relieve or end sciatica nerve pain. One of the most common causes and risk factor for sciatica nerve is poor body mechanics and poor posture for a very long time. And that includes slouching forward, sitting in the front of the computer for a very long time with a poor posture, poor body mechanic. And the most commonly causes for sciatica nerve pain is lifting with poor body mechanics that's not engaging the core and causing a strain in the back, and could lead to the other causes that will be in this list. So one of the poor body mechanic is lifting while you're twisting. So you're lifting an object and you twist it at the same time. That increase your risk of having sciatica nerve pain, which actually could lead to herniated disc or osteoarthritis, which is actually degeneration in the joint of your spine, the vertebra, the spinal vertebrae, that could actually cause or lead to sciatica. So when you look at this list, it's very important to follow proper body mechanic. When you lift, engage your core, suck your stomach, and bend your knees instead of leaning forward to lift, and don't lift while you twist. So that's one of the main and major risk factor and causes for sciatica nerve pain. So if you not following proper body mechanic or posture, that will lead to herniated disc. As you see in this image, you see the disc here. This is a normal disc, and this is the spinal cord, and you have the spinal nerve is coming out here. So when you have herniated disc, that's mean there is degeneration in the disc here that actually compressing on the nerve, and that will cause the sciatic nerve symptoms. And you can see it from the side view here. When the disc is taken out, it's actually compressing on the nerve here and could lead to sciatica. So this is a front view of your spinal vertebrae, and when you have herniated disc, it's very common to have it right here, that going backward here. You have the sciatica nerve coming from L4 to S3 in the back here and goes down to your legs. So when you have herniated disc, that disc is sticking out and compressing on the nerve. That's one of the causes. There's other causes, and when that happens, it compresses on this nerve, and you start to have sharp shooting pain going down to your buttock, your legs, and your thigh. So when the disc pushing here, it could cause the radiated pain. So that's the second cause, herniated disc. The third cause is the osteoarthritis or degeneration in the joint, and usually that happens from overuse of a lot of lifting, poor body mechanic, poor posture for a long time, that cause degeneration in certain areas on the vertebra in comparison with the other area. And when that happens, it actually could cause the exact same symptoms of herniated disc, because you will have some bone spur that actually compressing on the nerve that could cause radiculopathy pain. And you can see it in this image. When you have osteoarthritis, it's degeneration in the joint here that could actually cause compression on the nerve. Healthy spinal cord with the spinal vertebrae, you will see like even clean lines here for between the disc and between the vertebrae. But when you have osteoarthritis, you start to have degeneration here that compressing on the disc and also compressing on the nerve. So the second cause is osteoarthritis. The third cause is spinal stenosis. And that's basically, you have here the spinal canal that you have the spinal cord is going in through it between the vertebrae. And when you have a spinal stenosis, it's a narrowing of that canal. So the spinal nerve that going through it will be compressed. And that's usually could happen from genetic, or also could be osteoarthritis, that narrowing the space in the spinal canal that cause spinal stenosis. The fifth cause that extremely overlooked by healthcare providers and patients is piriformis syndrome. So a lot of healthcare providers and usually look at the back and looking for herniated disc, for degeneration in the joint in the spinal canal, but they overlook the piriformis syndrome, which is actually a common issue for sciatica that's not related to the back, the spine itself. So we have in the back here, you have the sciatic nerve is coming this way, and we have a piriformis muscle that's going in this area. 20 to 30% of the population, the sciatic nerve is going actually in between the piriformis muscle. So it's actually going through the piriformis muscle, which is attached in this area. When that happens and you have a scar tissue or inflammation or muscle spasm in the piriformis muscles here, that will compress on the sciatic nerve and cause radiculopathy pain. And that's very overlooked because most of healthcare providers, they do images for the back, but they don't look or assess properly the piriformis syndrome. And here is the issue. If the problem in the piriformis syndrome or the piriformis muscle, there is nothing they can do in the back will do anything to piriformis syndrome, and that will not resolve the symptoms. So proper evaluation extremely important to distinguish where is the sciatica nerve pain coming from and what the cause. Because if we don't know the proper causes or the triggers, the treatment basically masking the symptoms and will not resolve it. Less common causes, spondylolisthesis, which is actually slippage of the vertebra, and that's usually degeneration in the vertebra and in the state of the vertebrae on the top of each other, is one of them slide over, and that compressing on the vertebra, the nerve, the sciatic nerve, or could be fracture or degeneration in the vertebra. Another less common cause, tumors in the lumbar spine, and Coda-Iguana syndrome, which is a very rare disease. Feel free to check the link below for the 3 powerful treatments to end sciatic nerve pain. If you have any question or comment, leave it in the comment section and I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to ASTRinstitute.com.